Let's react to another Brett Cooper video. This one's called The Scary Truth About Filler.
I already didn't like filler. I think if you guys watch the show, you know that we have talked at length about the uptick in women's cosmetic procedures and what that means for women's health and their beauty standards and overall confidence.
There's different types of filler out there, and hyaluronic acid is surely the most common type that's used. But keep in mind that there are other types of filler materials, and that can include something like Sculptra, something like PMMA. Also, Radiesse is yet another type of filler, and these are used currently, not just like in the past, but hyaluronic acid filler is going to be the most common one, but there are these other fillers out there as well. And then there are ones that are not really used anymore, or really not used often at all, like silicone, for example.
But there was something that I did not know about this hyaluronic filler, and maybe this was common sense for some people, but I just completely believed what the doctors were saying, and even though there were things that I didn't trust about it and didn't like about it, I did not know the specific fact, that it actually never goes away.
I think what we know now is that in part it does go away, but not completely. And that's something that I think really isn't publicized enough. There are some research studies now that support that with MRIs, and maybe she'll get into that. But surely it's not really promoted as often as it probably should be by the companies that make these different fillers, and also by the doctors and the other providers that are injecting these fillers. So I think it's an important point to raise and to discuss.
So women online who are trying to be more natural will talk about going in to get their fillers dissolved, and it's also a common understanding that you usually wait until your filler naturally dissolves to go in and get more syringes of it, whether you're getting it in your cheeks, your jaw, your nose, your under your eyes, whatever you're doing. But MRIs that are now going viral on social media show that this filler actually never goes away. It just migrates, and in many cases, it expands. This information just hit TikTok, and the response has been wild.
Well, remember that hyaluronic acid is like a sponge. In general, the HA in all of our cells works that way. It attracts water. So it's going to be like a sponge. It's going to attract that water, and it's going to fill up. So it's not so much that the actual filler is getting like more plentiful, but it's actually that it's attracting water, and that's giving the face a fuller, plumper look. So there's a little bit of a distinction there, and it's also migrating into adjacent areas and doesn't exactly stay where you've injected it for forever. And just like HA filler, HA serums, like the one that we have at Feel Confident, for example, has different molecular weights of hyaluronic acid that also attract water in different ways. Those serums are, of course, applied topically, so it's not like they're sticking around for forever or migrating into weird places. But when you're injecting the HA, such as with the most commonly used filler, then you have to worry about all the things that Brett is about to mention.
All right, so the video that started this conversation on TikTok was from a doctor who took one of these MRIs and decided to talk people through it. And they were absolutely floored. Just watch.
So what you're looking at here is an MRI image of a 33-year-old patient who had over 12 cc, which is 12 syringes of hyaluronic acid filler injected to her face over the past 6 years.
And people are starting early with these fillers, right? So you have to imagine how their face will look over the course of many decades. And we don't even have that data yet, like over the course of 30, 40 years. And then you go and try to dissolve all of it. That's not so easy to do.
We measured the amount of filler, the amount of volume that was there. It ended up being close to 28 cc.
Okay, so just to recap. This woman, over the course of 6 years, got 12 filler injections. But now, based on the volume that is in her face, that is equivalent to 28 syringes. She has 28 syringes of filler in her face because it never actually dissolves.
Remember, it's like a sponge, so those 12 cc's are going to attract at least double that in overall volume as they attract water with time. Some would think of that as a pretty good deal. You paid for 12, but you got 28. But that's not the right way to look at it.
And what this shows us is that hyaluronic acid fillers are hydrophilic.
Hydrophilic means that it's attracting water, and that's how it's functioning as a sponge.
Imagine that, like cottage cheese, just like sitting under your skin. Oh my God.
That means they love water, and they also cause tissue expansion.
So for many women, like me, They had no idea. Like, I knew that there were consequences of filler. I knew that it was not natural, that it was not good for you. I had no idea that it actually never went away. Somebody commented and said, when it first came out, all injectors said that it would only last 6 months. And the guy responded and said, that's what the filler companies were telling us. That is what they were telling doctors.
They had, I guess, enough data to support that type of claim, but I think in their initial studies, they weren't doing these comprehensive MRI studies and really seeing the effect ultimately of these fillers. I think what they were looking at was more the actual cosmetic change that was created with the injection in the first place, and did that stick around for 6 months, 9 months, a year? And in reality, the actual cosmetic change that you initially create when you inject this stuff is there for not years and years and years. Usually it starts to fade out. So it's a reasonable conclusion, I think, if you're not doing all these MRI studies, for the companies, the manufacturers, to make that, hey, like, it's only there for 6 months, 9 months. I don't think they were necessarily trying to deceive the public, but surely these more extensive studies are critical for our understanding of what these fillers do, and also of long-term, in a way, complications, right? You don't necessarily want this stuff to stay in there forever and to expand and give you more volume. And people find that difficult to control and to adapt to as they age and mature. So, I think now that we know more of this information, I wonder how the messaging might change from these same manufacturers. We'll see.
I mean, like, what is it with the medical industry that somehow is apparently just, exempt from all regulations, exempt from actually being honest about what they're putting into our bodies?
Well, they're not exempt from regulations. I mean, these are products that have been FDA tested and approved, but you have to keep in mind that we don't have all the information in the beginning all at once, right? But now that we have more information, I think it's important to reassess what are we actually selling, what are we putting into our bodies, and where is this all going? So I think it's important to reassess, but a lot of times with new medicines, with new medical technologies, you don't have all this information up front. So it's not completely like a dishonest approach. It's just that you're working off of limited information.
Every other industry on the face of the earth has oppressive regulations from our government, preventing them from excelling, becoming more economical, becoming safer. But with big pharma, with big medicine, seems like that's not the case.
I mean, you can't discount what the FDA does and how they regulate. I don't know if she's forgetting about that regulatory body, or maybe she's pointing to the fact that they're not doing enough, but it's definitely a regulated type of market. It's not like they're just making this stuff and selling it and no one cares. I mean, there is governmental regulation and oversight. So maybe they should be doing more on the topic of fillers, that I think is a valid point. But to say it's completely unregulated is also not very factual.
Because again, the idea that filler dissolved was and still is common knowledge. And all throughout the comment section, women were saying, well, my esthetician is still telling me that I need to come in every 6 months because it's dissolving. Like, what is happening? Are they lying to me? What's going on?
Well, there's, again, this important distinction between the changes that occur aesthetically. So if you inject the lips, for example, they might not look as plump in 6 months, but that doesn't mean that the filler is completely gone from the face. It may have shifted, it may have migrated, but cosmetically, it might not appear as plump. So it's not necessarily an incorrect statement for the esthetician to suggest, or really shouldn't be the esthetician who's injecting, but for example, like a nurse practitioner or a physician to suggest, or a PA, for example, it's not incorrect for them to suggest that, hey, maybe you should come in for some additional volume if that's the look that you're trying to maintain. But I think they should also tell patients that, hey, this is something that might build on itself over time and migrate and cause these other issues. You have to be aware of that. So it's not like everyone out there is being dishonest and is spreading all of these lies. I think that it does sometimes come from a good place, but I think it's also important to balance that information with what Brett is talking about here.
And this video alone got over 9 million views, and it obviously sparked a huge conversation. This has now been popping up everywhere on the app.
We had a video from a few years ago where we were reacting to another video, and it was already talking about this same topic. So it's definitely been known, and those MRI studies have been out for years, but I guess it just happened to pop up on TikTok more recently.
And slowly, women started to realize that this information actually had been out there. It just hadn't been communicated to them by their own doctors. And this girl sums up my feelings very well.
Maybe this is naive, but I was kind of under the impression that after that doctor showed the 3D scans of all the filler in people's faces over time, that maybe the entire filling industry would be paused to a halt until they figured out what to do about the fact that the filler doesn't leave these people's faces. Because I think what they were telling them before is, I don't know, you get a syringe of filler in your lips, and then a year later it dissolves, it's gone, and you need more because there's no more. Well, it's not that the filler was never gone. It just went somewhere else in their face. I feel like if you get filler in your lips, after a year when you feel like you don't see anymore, you should have to dissolve your entire mouth area and then you could start fresh.
But I mean, what do we even really know about that?
Yeah, sometimes it makes sense to dissolve before you start injecting fresh filler, right? Similarly, when I perform lip lift surgery or any other lip surgery, I do like to dissolve the filler first. I think you then start on a cleaner slate, but keep in mind that there are some effects of filler that are more permanent, even if you were to dissolve all of it. So that expansion of the tissues that occurs can happen in the lips as well. So think of it as like a balloon where you're, say, inflating it with water, and then you're taking all the water out. It's not going to necessarily come down to the same size that you started with. It's probably going to be a bit more expanded. Similarly, parts of the face behave the same way.
Can the filler even be dissolved by a doctor? It might not dissolve naturally, but can they pull it out? Like, we have so many questions now.
Usually it's not pulling it out, even though you could potentially like squeeze it out. If, for example, you poke a little hole into right where the filler is and sort of squeeze on the tissues, you can physically squeeze some of it out. Or I guess surgically sometimes when I'm in there doing my lip surgeries, I can see filler. You know, there are times when I see filler, so I can literally squeeze it out from the inside. But the most common way to get rid of the filler is to actually chemically dissolve it, and that's the hyaluronidase that's used, or Hylenex, and that chemically dissolves HA filler. Now, the real question is, how much of an effect does the hyaluronidase have on our natural tissues? And that's something that we still don't completely know. But those of us who do a lot of surgery, especially around the lips, what we've observed is that if you place high concentrations of hyaluronidase in the mouth or around the mouth area, you will start to dissolve and start to thin out some of the natural tissues. So surely I think there's at least some impact on our natural tissues, because our natural tissues also have hyaluronic acid. So dissolving HA filler is not without its risks.
The only thing that I've seen online that might be effective is people use those like gua sha things and they'll massage their filler back into place. It's the weirdest videos. It's like women and they have lip filler and it's moved all the way up to their nose and they like put their fingers up their lip and like massage it down because it's moved so much. Like it's gone into their cheeks. It's so, oh my God.
And you're never going to get it back to exactly where it was injected, but I guess you can try.
Oh my God, it's so weird. And yes, like that girl said, you would think that there would be some guardrails on this entire thing, or that they would be trying to get this information in front of women, but that's not how things work. Somebody commented and said, I went to a plastic surgeon for filler and he refused. I was so mad, but now I am so thankful. You know, like good doctors will actually tell you the truth and will advocate for you based on your personal experiences.
Yeah, I say no to people quite often for actual surgery, whether it's their hair or their lips. And some people are mad, some people get very frustrated, they don't understand, like, why would you not, you don't want to work with me? They think it's like necessarily something wrong with like them, but sometimes it's a personality mismatch, but sometimes it's anatomically, I just don't think it's a good idea, and people can get very upset, but that's always better than operating on them and then seeing them be dissatisfied, or even from the surgical perspective, being unhappy with how the results turned out, even if they love it, right? Like you want to create results that are representative of the rest of your work and do a good job of broadcasting your practice and what you're capable of and your overall aesthetic. Now, if you create a result that's very far off from that, now that might turn off a lot of other people. And ultimately, that actual patient might be upset down the road because initially they thought it was a good idea, but then they might realize, hey, this wasn't a great idea. So that's always a risk that you run into with cosmetic procedures. But yeah, I think it's important to know when to say say no.
Good doctors will actually tell you the truth and will advocate for you based on your personal experiences and your body and your health, even if it means they will not make money off of you and they're losing money because they're not giving you that vaccination, because they're not doing that filler, because they're not doing that procedure. That is a good doctor.
Yeah, I definitely would be a better businessman if I wasn't as ethical. But in my mind, I always keep that separated, like what people actually need and what I can truly do for them from like the making money side of things. And I think that if you want to have a sustainable practice and one that, has some legacy to it and one that, will work for many decades, you need to practice in that way if for, cosmetic types of procedures and for any other type of procedure. There's many more functional things, right, that need to be done with a good ethical approach and not just to make more money. That's actually, I think, in many ways scarier when people are doing something like putting in cardiac stents or doing functional sinus surgery, and they're going in and not really doing indicated procedures or futzing around a little bit and then saying that, hey, I opened up all the sinuses, or, saying that they put in more stents than they actually did, or putting in stents when it's not really indicated, so there's a lot of sort of sketchy things that happen. But I think that most doctors are ethical and are trying to do the right thing.
Somebody else said, this information is sending me into an anxiety attack about my lip filler. Same, and I don't even have filler. I'm just anxious now about the entire thing. Somebody else said, it genuinely snapped me out of some of my body image issues when I learned about how little long-term research there is in simple routine cosmetic procedures. Like, I'm good, actually.
Yeah, and actually many patients now are coming to me for my lip lift procedure because they're actually scared of even getting started with lip filler. So younger patients who don't want lip filler, they don't even want to try lip filler, so they rather go for something that, yeah, it might leave a scar at the base of the nose, but it will give them something that will last longer and that has more predictable risk than filler in many cases. Now, I don't think that everyone's a candidate for a lip lift, and sometimes I actually push some of my younger patients to consider alternatives such as, say, lip filler. But it is an interesting trend that some people don't even want to try filler, and they don't even want to get started on that road.
And I mean, listen, we all have insecurities. We're all worried about our skin at different points in our life. I mean, there's so many other alternatives. There's so many natural alternatives than shoving filler up your face. Like, you should just be taking collagen to start with.
Yeah, we have a video on collagen supplementation, so make sure to check that out. And there's no ad in that video. It's just about collagen. So if you want to actually learn about collagen supplementation, the pros, the cons, what are the actual recommendations, then make sure to check that one out.
Another person said, it is still wild to me that in like 5 years, getting filler went from being considered plastic surgery to being like getting your nails done. Yeah, like now it's on TikTok of like, come get filler with me, come get injected for the 4th time this year. It is wild.
Yeah, I mean, because in many ways it's gone corporate, right? So you have these big companies now that are like VC backed, and they're all over the country, and like you literally can just like stop by during lunch and get it done, and you don't have to wait weeks or months to get on a doctor's schedule. You can just see a nurse at one of these facilities. Most of the facilities don't even have doctors around, and they'd be happy to inject as much volume as you'd like and as much as you are willing to pay for. So it's become very corporate, and hair transplants, for example, have been corporate for decades now, and it's never quite the same attention to detail and patient care compared with a more boutique practice that actually cares. Kind of alluding to what Brett was saying earlier, there's a big distinction when people actually care about you and want you to do well, and sometimes that means telling you no for surgery or for injectables, versus when it's run as a corporate structure, when you just more is better. So the more patients you work on, the more money you make. That's all positive. Well, in reality, it's not always positive.
And then to loop this into another episode that we did, that is why I really don't feel bad for Kylie Jenner when she was sitting on the Kardashian show and crying about people making comments about her face. Like, girl, you drove an entire generation of young women to also do this to your face. You and your sisters created the standard. You lied about your cosmetic procedures, made everybody else feel terrible about themselves. They did this. They now regret it. They're angry at you. Now you regret it, and you're not taking any accountability. Like, this is just such a crap show.
And we have a video on Kylie's transformation, so make sure to check that one out.
Now, speaking of Kylie and other celebrities, another big topic of conversation under this umbrella has been pillow face. And if you don't know what that is, think Chrissy Teigen, as of recently, big puffed up cheeks, or Kylie Jenner at the Met Gala, where everybody was saying that she looked like she was 40 years old. Their faces basically look like they've been blown up by a balloon. That is pillow face. And that is all because the filler has not dissolved.
And also keep in mind that some people get fat transfer as like an actual surgical procedure, but fat can also be used essentially as a filler. And when that happens, the fat retains some of the memory of where it came from. So if you were to gain some weight, let's say in the abdominal region, well, if you have the fat from the belly placed into your face, it's going to start to plump up your face. When if you didn't have the fat transfer, the fat would have just been in your belly and maybe your midsection would have been a little bit wider. But now you have that same fat in your face, it's going to expand and you're going to look puffy. And that's much more difficult to resolve and to get rid of because you can't just dissolve it with hyaluronidase, right? So that's something else that many celebrities have done, especially if they're getting like a facelift. They might get the facelift with fat transfer, and then they risk having these kind of pillowy faces that are much more difficult to reverse.
So we now have an explanation of the pillow face phenomenon, which is that filler does not just dissolve.
That's so... Oh my God, it's so sad for her. Well, actually not really, because I hate Chrissy Teigen.
Brett really speaks her mind. You can't take that away from her.
But it's just sad for anybody who has gone through this and now has this kind of face.
Metabolize over time. It in fact migrates or spreads to other areas of your face and continues to cause tissue expansion. And so the people who make a habit of getting filler regularly, this is kind of what you end up with.
We have a Madonna video. Check that one out too.
Like, I always knew there was a possibility of the filler migrating or seeping into other areas of the face.
I mean, this is just crazy.
Some people ask me, like, why do you cover celebrities? Why do you make these analysis videos? Like, what's the point, right? So in many cases, we can actually learn a lot from what these celebrities are having done. And that sometimes can be very instructive. And it can sometimes maybe suggest to somebody that, hey, I want to look like this person, and these are the procedures that I might need to get. But in many other cases, people look at some of the celebrities and say, hey, I don't want to look like that. Like, what do I do to avoid looking like that? So maybe then they should avoid those procedures. But either way, it's somewhat instructive and you can gain something from it. Plus, many people are just curious what their, favorite or least favorite celebrities have had done. And it's a good way to just learn about facial anatomy and some of the ways that these different procedures are actually performed.
They had not studied this. I mean, were MRIs a thing 3 years ago? Yes. Was nobody looking into this? Like, mind-boggling.
Like, is the protocol now to always do a round of dissolvent before putting in more filler?
Is she using the Feel Confident HA serum? Huh. Gotta look into that one.
I mean, it's just wild. And it's wild that there's no standard of conversation or standard of care as all of this information is coming out. Somebody commented and said, I've never been more happy to be too broke for this stuff. Another person said, I lost 2 friends to filler. They didn't pass or anything. I just couldn't look at them any longer. Yeah, that's me with all the pillow face people. Now, even though that pillow face is obviously not comfortable and it is definitely not what they were wanting aesthetically when they went and got filler, what is more serious than looks are the actual health concerns that follow filler, specifically the impact that it can have on your lymphatic system. One commenter said, it clogs your lymphatics, then the lymphatics can't drain fluid, so it stays and causes swelling.
Yeah, and even more importantly than that, it's some of the acute risks of getting HA filler placed, or really any filler, including a fat transfer. When you get filler into your face, for example, it could potentially go into a blood vessel, and that's called vascular occlusion. Now, not just any blood vessel, but especially if it's in one of the main arterial blood vessels that actually supply blood flow to, critical parts of the face. If you get one of those blocked, well, then parts of the skin of your face can actually die, and then they actually need to heal, and you might get scars, for example. Or in kind of worst case scenario, you can get blindness if some of the vessels that are, say, in the face or on the sides of the head are interconnected with the blood vessels that supply the eye and vision and the optic nerve. Also, it's possible, though it's a very remote chance and extremely uncommon, there have been reports of people getting even a stroke if you place the filler at a high enough speed and intensity and into the wrong blood vessel. Well, then you can generate this type of effect. And that's, of course, an extremely frightening thought, but it's something that I think people ought to keep in the back of their minds when they're going and getting injected. I think that's important to know what could happen, even if it's extremely rare.
Just think about all of this gel sitting in your face where it should be draining fluid.
Yeah, because of the blocked lymphatics, oftentimes when you get any surgery on the face after the filler has been in there, even if you get some of it dissolved, the healing time is usually a bit prolonged because you now have more swelling in the face from the surgery, and that swelling usually drains through lymphatics, but now you've had some of your lymphatics blocked up, so that drainage is going to be slower, so you're going to stay swollen for longer post-op.
We wanted to investigate to see if fillers can block the lymphatics, which is your body's natural plumbing system. The answer was yes. What you're looking at is an imaging study that maps the lymphatics using a fluorescent dye. On a typical person without fillers, the fluorescent dye would disappear within 24 hours. However, she still displayed fluorescence for 4 to 5 days, signifying blocked lymphatics.
That is insane. That is intense. These fillers have been in use since 1996, and they've been common for over 10 years at this point. And we are just now having this conversation. The studies are just now coming out. Well, actually, all of this started coming out last year, but still it is not common knowledge. They've been studying it.
It's been more than just last year. I mean, I think we're on the order of 3 to 5 years that some of these early studies started to come out. But it takes time for people to start talking about it and for it to trickle out into the world, into popular common discourse.
But patients haven't been informed, and obviously the common populace certainly did not know. Last year, a new study was released on this, and the study found that hyaluronic acid has been found to block the lymphatic channels, which help the body drain fluid and are a key part of the immune system that helps to fight disease. Research is now being planned to see if the treatment affects the risks of diseases, including cancer. And there were so many people, obviously, guys, this is anecdotal. There is no hard evidence of this yet. There were so many people in the comment section of these videos saying, my mother's cancer was worsened because of the filler.
Oh, geez. Yeah. I mean, these anecdotal types of cases are usually not substantiated and are very difficult to really connect and prove. So you have to be really careful with what some people will say in forums or just different social media platforms.
The stories are just wild. They go on and they say, fillers have also been linked to cysts, lumps, and swelling, and facial pain. And then soon after the study came out, the British Association of Aesthetic Plastic Surgeons released this. Caution raised over potential immune system impact of cosmetic filler. Yeah, you wouldn't say this thing, this gel, this substance that stays in your body literally forever could have an impact on your physical health. Now, many doctors have still just charged ahead with their practices, obviously, because normal people who are getting filler regularly still do not know about this. But some good doctors have already taken a step back. One New York City plastic surgeon immediately halted all filler at his practice, saying that the problem is with the substance itself. No matter how skilled the injector, the substance can still block these lymphatic channels.
Sure.
He immediately stopped providing filler at his practice following the research findings.
Well, it's easier for a plastic surgeon to do that, right, when they can rely on some of the actual surgeries to continue to, keep their practice afloat. For people who focus on using filler in their practice, and that's mainly what they do, well, that's much harder for them to, to adjust and to look for other ways of feeding their, practice, feeding their families. So this is a complex topic, Is it that, most doctors are doing something, evil and that they're, trying to inject these things to make money and they don't care how the person actually ends up doing? I don't think that's the case. But should we be maybe pulling back on some of these procedures and really informing patients extremely well about the potential risk? Yes. Will people then stop getting some of these injectables because, hey, they know about the risk now? I think many patients will continue to get these injectables because they want to adjust how they look. And I don't think they're just going to be like, oh, well, now that we know about some of these risks, I'm not going to do it, because, maybe these bad things can happen. I mean, they still want to look more of how they imagine themselves looking, right? They want to look more youthful. They want to look more attractive. So many people, I think, would still continue getting it, even if you give them all of these risks. And I think there's still more that we need to find out, on the research side. So it's definitely interesting, and we'll see how all this evolves.